remove you from the building, so you get two choices. And speaking of Sergeant at Arms, we have Salisbury, Nina Ledge, Todd Jordan, and Terry McGraw with us today. And thank you for all you do to make these meetings possible. We have some pages with us today. I'm from Davidson County, so if I mispronounce your name, I apologize in advance. If you would stand up when I call your name, even if it's not correct. Ethan Kim, thank you. Samahita Mohan, did I get close? Thank you. Katie Owens, Kevin Santiago Jimenez, and Sophia Wang. Thank you very much. We have some great bills today, and we have some not great bills, but we're going to hear them. We're going to hear them all. Representative Lou's bill is the best of all. I think everybody needs to support that. How are you, Representative Carney? That's good. It's good to see your smiling face. And you go up first with House Bill 1166. You want to come over here so we can grill you?
Thank you, Mr. Chair, members of the committee. This bill 1166 has been before you for many years. It started in 2015 with a mom coming to my office from Charlotte, and her daughter had a rare disease called Batten's disease. They were in shock. The child was 7 and lived beyond that, but not very long. But it cost their family an enormous amount of money. They were fortunate that they could work through the system. But what they found was there's no really support system out there within the state for rare disease patients and families. So since that time that we passed that bill, and the number was House Bill 823, if you look it up, there have been 30, we were the first in the country to establish within state government a rare disease advisory council. Since the inception of that bill and it moving forward, 32 states, we were the trailblazers for the whole opening of the eyes of the country now onto the rare disease issues. So we're back today. When that bill was passed, it was housed over at UNC. And then from there, the department head retired and it was sent back to us. And we spoke with DHHS to house it there, where it should be, because of the resources that we can have and the accountability to the legislature and to members. I could go on and on about it, but what it does, this bill does, is it reorganizes some appointments to the Rare Disease Advisory Council. It transfers it to under the auspice of North Carolina Department of Health and Human Services. There's so many acronyms floating in this building, it's unreal. But it will be housed there, and the $250,000 is what they're requesting for the implementation of it. So I ask for your support for us to get this moving forward and get some answers to our continued supporters and recipients of.
Thank you. I believe Representative Pierce. Okay. This time, is there any comments or questions for the bill sponsor? If you're not, you might.
Got more of a comment.
Representative Lambert, you're recognized.
This is more of a comment. I appreciate the passion by which Representative Carney has worked on this for actually a while. And I'm supportive. I think this is something we desperately need, and so I encourage you to vote for this bill.
Just remind you, Representative Lambert is the senior appropriations chair, so he's not writing names down or anything. Feel free to vote any way you want to, but this time I'll entertain a motion for a favorable report to House Bill 1166 with a referral to appropriations. Representative Ball. Thank you. I appreciate that. Without further discussion, all in favor, aye? Aye. Any opposed? Thank you, Representative Carney.
Thank you, Mr. Chair. And I would like to just recognize my primary sponsors were Representative Lambeth, Representative Belk, and Representative, she's here.
We have one of my relatives is here today.
Renee.
Sitting on the front row.
Yeah. So thank you, committee.
Could she introduce herself?
She might turn red if you're recognized, Representative Cervania.
Thank you, Chair Potts. When it's Cousins Day, we often miss it's not during session, but I'm very honored to be your third cousin on our mama's side. Thank you
Mr. Chairman,
so
I
much.
thought y'all were double third cousins.
That's a different one, Representative. My family tree has a lot of low-hanging branches on it. All right, the bill passed. We got some serious work to do here, so we need to get on it. And I'll recognize Representative Art to do the PCS for House Bill 1086. And while you're coming without objection, the PCS is properly before the committee, and you're recognized, Representative Art.
Thank you, Mr. Chairman. First off, I'd like to thank, this bill comes to you as a result of a lot of stakeholders working on a critical and incredibly important area of child care. So I'd like to thank all the stakeholders and staff. I'd like to thank my co-sponsors on this thing, Representative Lambeth, Representative Perret, and Representative Ryan. This is a continuing work that we've undertaken to help make the child care situation better. This bill has been supported by the child care business centers and owners, the YMCA, the North Carolina Chamber, the community colleges, and the North Carolina Partnership for Children and Smart Start. So we've got a good bill here. What this bill does is create a career-ready lead teacher program that expands child care academies that allows workforce development and talent development. This also provides funding for mental and behavioral services for children and families, staff and child care facilities, establishes the North Carolina Partnership for Children Special Fund. It expands alternative pathways for administrator and credentials so that you can satisfy the requirement by two people rather than just one and someone else having to go back to school. So modifies that. We've looked at what makes child care difficult. Part of that is insurance requirements, and so we're looking at establishing a fund that may be like a captive insurance fund or something like that to look at reducing the insurance cost of child care facilities. And then finally, updates the bidding requirements for Smart Starts. We've been going through, I have two bills that adjust thresholds because of the inflation that we've seen. This adjust the bidding requirements for Smart Start. And with that, I stand for any questions. I know of no opposition.
Thank you. I know this has been a long, tenuous process for you trying to get all the stakeholders in agreement, so I appreciate the work you did. Yes, Representative Clark,
Comment for the bill sponsor.
you're recognized.
Thank you. I just wanted to applaud you for this bill as a mother who relied on childcare for a decade. This is critical. We have a childcare crisis, and I applaud all bill sponsors for this work. Thank you.
Representative Loftus, seeing no other comments, you're recognized.
Mr. Chairman, I'd like to make a motion for a favorable report, unfavorable to the original, and refer to appropriations, and if favorable, refer to rules. Thank you.
That was a motion for a favorable report to the PCS, unfavorable to the original, with a referral to appropriations. Thank you, Representative Loftus. All in favor of the motion, aye. Any opposed, likewise? Thank you,
Thank you very
Representative
much.
Hart. Thank you very much. Representative Reeder, you're now recognized for House Bill 1090. Without objection, the PCS is properly before the committee, and you're recognized.
Thank you very much, Representative Potts. At the risk of going too long, I do want to talk a little bit about this bill that has been, I've been working on for several months now, to try to address the problem in rural North Carolina of access to health care. I'm going to give you a little bit of a history lesson in a minute, but what this bill tries to do is to create a fund for infrastructures, facilities in rural North Carolina. We know that North Carolina has the second largest rural population in the country, with about 3.4 million living in rural areas. 78% of our counties are considered rural. In the last decade, about 9 hospitals have closed their OB services. There's been 12 hospital closures since 2006. Rural healthcare facilities under tremendous pressure, both from an operational and for a capital to revitalize. If I go back in history, many of us were in counties where in the name of their hospital, it said Memorial. And that is from the federal government after World War II created the Hill-Burton Act, and that gave money to states and localities to build hospitals. So whenever you saw a hospital that had Memorial in the name, Wake Memorial, Pitt Memorial, that was federal dollars. Over the years, these hospitals and facilities that were built in the 50s and 60s have exceeded their lifespan. Some of the hospitals, if they were attached to a health system or in a more affluent area, they got money to revitalize, rebuild, renovate. Unfortunately, across North Carolina, many of those facilities have not been able to been revitalized or rebuilt, and we see that tremendous pressure in North Carolina. What I'm attempting to do in this bill, and I've spoken with many, many stakeholders across the state, is to create a fund for infrastructure improvements in rural areas. And the policy that we're trying to address, and I believe, is that North Carolina owes a responsibility to its citizens in rural areas to have access to health care. And that's the genesis, that's the policy provision of this bill. We know that having access to health care in rural areas is important for a successful community. If you don't have health care, you can't have jobs, you can't have economies, you can't have people live there. And unfortunately, across North Carolina in these rural areas, too many of our communities are suffering and dying for lack of healthcare infrastructure. So that's what we're hoping to do. So this bill has a couple of components to it. The blueprint for this bill came from a work that this body funded last year. It was called the North Carolina Rural Health Sustainability Project. This was funded by the legislature 2 years ago, and it said, what do we need from a regional perspective across North Carolina to build infrastructure? And this group, through a lot of good work, went regionally through the state and said, this is what's existing. This is what we think is sustainable for a region. You might need one rural emergency hospital, a community hospital, and regional referral. That's the blueprint that I'm hoping this fund and this council can address. So the bill does a couple things. The first is to create a fund, and we call it the Rural Healthcare Infrastructure Fund. You could think of this almost like a SCIF, but for facilities in rural areas. This group will have money that can be funded from a number of different ways. It could be state dollars, it could be federal dollars, philanthropic dollars that come into the states, economic development dollars that would help go into this pot for rural communities to apply for and get These funds could be structured as grants. They could be low-cost loans. The responsibility for the entities that gets this, however, because they're using state dollars, they have some responsibility, and we as a body have responsibility to make sure our money is spent wisely. So through contractual obligations of these entities, they will have to maintain services and other things that I'll talk about in a minute. So we say, okay, we have a pot of money. How are we going to administer this? I talked with a lot of stakeholders about where this might exist in existing departments, divisions, and we never really came up with a great way. So we are going to create a North Carolina Rural Healthcare Infrastructure Council that will have appointments from the governor, from the General Assembly to help administer this program. And that's going to be the role for this committee over the council for the first year, is to say, come up with the rules of how the money can be spent, what's the process for applying, and how do we manage this? So that's really the first part, is creating the fund. The second one is saying this council is going to be appointed by this fall, and they're going to work over the next months to develop the program. And the next part of the bill is there's an existing rural healthcare stabilization fund. This fund was created by this body many years ago in order to help save a hospital in Randolph County. There's about $39 million in that fund currently. Randolph County had borrowed money from that, and they're paying that back. This bill would transfer that money to this new entity, the Rural Healthcare Infrastructure Fund, to allow that council to start work developing the rules. This bill, the attempt is really to make sure that we have ongoing infrastructure funds for rural North Carolina. I'm happy to answer questions, but I would appreciate your support.
Thank you, Dr. Reeder. It's good to know about the Memorial Hospital. I was born in one, which is now a retirement home, apartments for the elderly in our city. So that was good to know that. Any questions? Representative Crawford, I reluctantly recognize you, but it's good to see you again.
I'm sad that it's reluctantly, but thank you for the recognition. Just a quick question. I know that previous iterations of this bill had different councils kind of administering the funds. And so can you just talk a little bit about the evolution of creating this infrastructure council?
Representative Reeder.
Yeah, I won't give you the whole, because we went through many, many iterations of different existing agencies, different departments. Could it be in Commerce? Could it be at Treasury? Could it be? What we identified, what I learned, is that there's no existing group that's out there that has the capabilities, the capacity to do this kind of work. And we tried the Medical Care Commission, we tried the SHIC. None of them seemed to meet the needs completely. We worked a lot, and I want to work with the department a lot on this bill to come up with this existing council, because it's not just administering money, it's receiving grants, doing feasibility assessments, understanding operational details. That's why we felt that there was an existing entity, and so we reluctantly had to create something new. I was really trying to find some place that would exist, but it just wasn't there.
Representative Campbell, you're recognized.
Motion if it's the appropriate time, Mr. Chair.
If I
don't see any other.
If I may.
I got a comment.
Yeah, I do want to apologize. I want to thank the co-sponsors of this, Representative Lambeth, Representative Green, Representative Ward, who have been helpful on this. This affects us all the time in where we work and where we live to ensure that we have access to health care.
Chairman Lambeth, you're recognized.
And again, it's just a comment. I think this is very timely. I think we all recognize the evolution in healthcare and the need to protect and really grow our rural health systems. It becomes a key point of access. And if we don't have a hospital in our rural areas, we don't have access, and they have to travel, and it makes it very difficult for emergent situations. So this, I think, is a good next step. You know, we should take a lot of pride in this body for having improved access across state, particularly with the Medicaid expansion. But this is a good next step to make sure that we are looking out for the rural areas. And I talk to people down east, I talk to people up in the west, and access is still a big issue. And I applaud Dr. Reeder for his work on this. He has listened to a lot of stakeholders. And it may need a little bit of tweaking still, but we need to move this bill along so we can try to get this passed and try to incorporate this in the financial plan that we come up with. So again, I applaud him for his work on this.
Representative Blackwell, I assume you heard Chairman Lammers say we need to move this bill along.
Yeah, and I wanted to call your attention to the fact that on the first two bills, I made no comment and asked no questions, so you could cut me some slack, please.
All right, well, you're recognized. Go ahead and take 8 or 10 seconds and ask your question.
Dr. Reeder, in the original bill, there's a provision that says that the plan will include a description of what constitutes healthcare infrastructure located in a rural area of the state for the purposes of the program. I may be missing it, but I don't see that in the PCS as such. DHHS has already, in another context, decided that certain counties like Wake are rural, but Burke County, where I'm from, is not. And so what is there in this bill that addresses what would be considered rural?
Dr. Reeder.
Depending on which agency, which person across state government, you can find multiple definitions of rural. I didn't want to try to legislate that in this bill. This would be one of the tasks for the council, as they're pointed, that they're going to struggle with defining rural. And we will continue to have feedback because the council will come up with a plan for how this is implemented. It still has to come back to this body to approve. Although we heard about the rolling hills of Wake County in one of our discussions about the Rural Health Transformation Program, and other groups have tried to define rural as the patient is rural, so therefore if they get transferred to Charlotte, somehow that should be part of this. For me, rural is defined by geography, and we need to make sure that these funds are used to build access in rural areas, not that we build infrastructure in urban areas to take care of rural patients. So that is going to be one of the things that, as this goes through the process, I'm going to be very much interested on to make sure that the money and the facilities end up in the right zip codes.
Thank you, Mr. Chairman, for your indulgence.
Thank you, Representative Blackwell. It's always good to see you on a Tuesday morning.
I like for you to start your week off well.
Thank you. Representative Campbell, get us out of this before we get in more trouble.
Representative Reeder, as a child of Harnett County, I thank you for your efforts. And Mr. Chairman, I would move for a favorable report to the PCS, unfavorable to the original, and referral to appropriations and if favorable there to rules.
You've heard the motion. All in favor, aye. Opposed likewise. Thank you, Dr. Reeder. I think you're up for the next one as well.
Yes. Thank you very much. I don't think we have a PCS for this one, so we actually got it right the first time. And I want to start off by thanking the other members who have been working with me on this, Representative Chesser, Representative Campbell, Representative Perret. This is not so complicated, and we don't have to go as far back in history for this one. But this bill really gets at helping our citizen deal with the rising cost of health care and the affordability issues that we're all facing. Right now, what the bill does is allows you to deduct up to $5,000 on money that you have spent for prescription drugs or co-pays. Right now in the tax law, if you spend over 7.5% of your adjusted income, you can deduct those healthcare expenses. Many citizens never achieve that level of spending. This will say that if you have co-pay or prescription costs, you can deduct them on your tax bill. Right now, there's about 4 million people who itemize their North Carolina deductions. This will affect about 10,000 of those, as best we estimate. So about 400,000 people this would apply to. If we pass this bill, it's estimated that we're going to put about $80 million back in the hands of North Carolina citizens over the next year. So it's a short bill. It says you can deduct some of your prescription costs on your itemized North Carolina taxes. Happy to answer any questions.
Thank you. Representative Sabania.
Chair Potts, a question for Representative Reeder.
You're recognized.
So you cite the current legislation with the 7.5% reimbursement, but it also actually includes the reimbursement or to include not only prescription drugs, but medical, dental, and vision. What was the decision to not include that in the same structure?
Representative Reader.
When we were balancing the revenue for the state and the tax deductions, if we would have included all health care expenses, the number was approaching $400 to $600 million. And so we were focusing primarily on those lower expenses that more individuals would face. And so that's how we limited it and arrived at using this for prescription drugs.
Thank you. Other comments? Is there a motion? Representative Campbell.
Mr. Chair, I'd like to make a motion for a favorable report on the original with referral to finance, and if that is favorable, referral to rules.
All right, and that's House Bill 1074. All in favor of the motion, aye. Any opposed likewise? Thank you. Representative Liu, you're recognized to present the PCS for Bill 1193, and without objection from the committee, the PCS is properly before us.
Thank you so much, Mr. Chair and members of this committee. I want to acknowledge this bill, and this bill wouldn't be possible without the support of families and LA of Representative Mike Clampett. And this bill aims to honor the late Representative Mike Clampett, who battled with leukemia and served the state until his last month. I respect his public service, not only as a legislator, but as a firefighter and first responder of our state. The Mike Clampett Bone Marrow Donation Awareness Act is a start of sensible bone marrow donation legislation for our state. This will equip the DMV and DHHS with the tools to properly raise awareness to inform our citizens about the importance of donating bone marrow to save lives. The proposed PCS would direct the DMV to begin implementing the system by 2028 that allows individuals obtaining a driver's license or ID to opt in to receive registration information from the National Bone Marrow Donor Program. This approach focuses on awareness, education, and voluntary participation while helping connect more potential donors with those in need of a match. I just want to acknowledge my co-primary sponsors, Chair Potts, Chair Lambeth, and Rep. Crawford for your input and partnership of this bill. I have a friend, Charlie. He was dying without the bone marrow donation during COVID, and thankfully he got the donation he needed, and he's able to watch his children go to college. So this important legislation, so let's get more access to our patients and save many lives for generations to come. Thank you, Mr. Chair.
Representative Ferguson, you're recognized.
For comment, please. On behalf of my predecessor, Representative Clampett, this is a wonderful bill. In addition, I also lost my mother to multiple myeloma a little over a year ago. In 2018, she received a stem cell transplant that gave us not just an additional 5 years, but an additional 5 good years with her. So I think this bill is wonderful, and I urge everyone to pass it.
At this time, Representative Ferguson. Moves a favorable report to the PCS, unfavorable to the original, with a referral to rules. Thank you, Representative Ferguson. Any further comments? If not, all in favor, aye. All opposed? Thank you, Representative Crawford, for being on the bill with me. It's the highlight of my year, so I appreciate that. Without any further business, and we certainly don't need any, this committee is adjourned.